to exercise caution during the Passover. Simelane held a meeting with various religious leaders in the province as part of government's efforts to intensify the education and awareness campaign about the coronavirus. In all of the 24 confirmed cases in South Africa, the infected people travelled overseas. Simelane says there are some traditions that the church leaders will need to assess to help prevent the spread of coronavirus. We're now joined from our Durban studios by the KZN Health MEC Nomagugu Simelane-Zulu. Very good morning to you, MEC. Welcome to the agenda. You've had meetings with religious leaders. Just what were the outcomes?
Good morning, ma'am, and good morning to your viewers at home. My name is Nomagugu Simelane-Zulu. We have definitely had meetings with different stakeholders as part of our different communication strategy with the communities. We had the first initial meeting was with the principals of all the schools in the Nomagugu district that was firstly affected, and we're going to be rolling that out to all the other districts. Subsequent to that, we met with the religious leaders in the province, which are leading the province, and after that we met with the same religious leaders but now at district levels. The outcomes were extremely good. The religious leaders were very excited by the information, firstly because they also believe that information is power and they would be able to share the said information, but it will also empower them to make decisions that are going to be assisting government in addressing and dealing with this virus. And we are having continuous programs. Today we are meeting with the provincial leaders, provincial traditional leaders in KwaZulu-Natal, and we are going to be coming up with a plan of how next week we will be going to the different districts and meeting with now all the traditional leaders, including Izinduna and Amakosi, so that we can engage and give them the information necessary, but most importantly come up with a plan on how do we ensure that our society, particularly in traditional and rural areas, are aware of this scourge and we are able to talk to the preventative measures that needs to be taken. You'll remember that in some of our areas we might not necessarily have running water, so the discussion today is going to have to include COGTA on how do we then assist those areas, because one of the preventative measures of the virus is that we say people must always wash their hands with soap and water. While we say the sanitizers are good to buy, but there are poor people who might not afford them. So soap and water is good, but the water needs to be running water. So we will be having that discussion on how we are going to implement that. But our program goes beyond just that. We decided that we also want to meet all the structures at a provincial level. After that, we then go to the different districts with the set structures. Next week, from Monday, we are going to be meeting with the taxi associations in the province. We will be meeting with the organized labor in the province of KwaZulu-Natal, so that we also engage with them and have a proper understanding on what needs to be done. We have met with the University of KwaZulu-Natal in relation to the research part of it, but later in the week, we'll be meeting with all the DVCs and the vice chancellors in the province, because we have two universities in the province, but we also have DUT and MUT and a number of FET college or TVET colleges. So we have a rolling program. We have given ourselves just the next 3 days to engage with the provincial structures. Immediately after that, we then go to districts and meet with all the district stakeholders. In the province, we have a structure and a program that we call Operation Sukumasake that encompasses all stakeholders in each district. The champions of those Operation Sukumasake districts are the MECs. So as of today, all the MECs are engaging with their districts, district task teams, local task teams, and the different mayors to give the information and have a plan on how we will be able to reach everyone. Because our target is that we need to reach every single corner of the province so that everyone knows what is happening firstly, because that's where we need to start to demystify what is going on. And that's why you see that the minister every day issues an indication on where we are in terms of the cases, so that there is no fake news and we all know who's the point of call when it comes to information.
Are you satisfied with all of these efforts, or is there more that still needs to be done?
We are satisfied with the plans that we have. What needs to be done more is the partnership between ourselves and the community. And at this point, it looks like the society is willing to come on board. The society was just waiting for government to come and engage with them. And as we have started engaging, you can see that it's really bearing fruit. You can see with the engagement we had with the religious leaders, because they had already started immediately at the end of our engagement with them a couple of days back. They had decided to write a letter and deal with these traditional practices that they have in their different churches, and they started agreeing on the processes and things that needs to be done. We started rolling out engagement with the religious sectors in the different churches. We'll be putting up posters there, we'll be issuing flyers. So yes, we believe that the only thing that was missing was that link between ourselves and the leaders of the society. Now that we have that, we will definitely be able to get to everyone, and everyone will have the information that is needed, including those that are unable to read, because we take that into consideration, that we've got quite a bigger population that is illiterate, and we've got a program on how we are going to be engaging that illiterate population.
Just take us into your conversations with the religious leaders. Was there any fight back in terms of wanting to change their protocols?
Not at all. The religious leaders were just waiting for information, because some of the traditional practices that they have in their churches, we didn't even know about them, because remember, you are talking about when you meet with the KwaZulu-Natal Council of Churches, we are meeting with a very broad spectrum of the religious sector. We're also meeting with the charismatic churches to say to discuss the same matter. So there has been no pushback at all. All they needed from us was for us to give them the information, but to also get advice from the Department of Health on how best can they relook at the other practices that they have. Of course, there are some practices that they might not be able to let go altogether, but together around the table we could come up with a way on how best to implement that will not infect our society and our communities.
These protocols, MEC, are very ingrained. For instance, the Catholic Church this week gave out a memo to their different churches all over the world to say there'll be no more touching of hands when you are giving peace to the other congregants. How do we now convince congregants, the general society, about the need to change mindset? Well, for us to be able to change mindsets, you need a program that encompasses everyone, a buy-in from government, a buy-in from the leaders of the society, but a buy-in from the religious leaders themselves. I believe with the approach that the religious leaders have taken after our engagement, we definitely are going to be able to get a buy-in from the congregants, because they now are aware that if we continue with doing things the way that they are traditionally or have traditionally been doing them, it means we are exposing ourselves to a risk of infection, but not just ourselves. We'll also be exposing our children and the whole society. So for me, the most important thing was to get a buy-in from the church leaders themselves, because once we have that buy-in, I think it's very easy for a conversation to ensue between the leaders and the congregants. So you're having conversations with different sectors in the province, some of which I imagine will be province specific. But just tell us how your plan ties into the national plan that leads up to the National Ministry of Health with Dr. Zweli Mkhize.
Our plan is in line with what the minister is doing, because when we had an engagement with the minister, remember, we were the first people in the country to actually get a case. So we had an opportunity to sit down with the minister and agree on the protocols and things that needed to be done. And when we presented our plan to the minister, he was extremely excited, and he added that, by the way, in relation to the sectors, we don't need to overlook the business people, and we've been having those engagements, and we are going to continue to have the engagements. We continue to have the engagements also with the private sector in relation to health. Remember, in health you also have your GPs, your private hospitals, and so forth. So our plan is in line with what the minister is doing. It is in line with the understanding of the minister, and I believe that he has taken what we have done throughout the country, and in Limpopo, that is how they started their engagements as well.
Minister, at last count, there were 2 infections in the province. Just give us an update on how these 2 cases are progressing.
2 cases.
I don't know if the MEC is still able to hear us. MEC Simelane-Zulu, are you able to hear us still?
Oh, yes, I hear you now.
Oh, I was saying that at last count, there were 2 official cases in KZN. Can you give us an update on these 2?
No, we had 2 cases 4 days ago. We have 10 cases now. Actually, we had 8 cases. 8 cases yesterday. Minister added 2 last night, so we now have 10. But with the first 2 cases that we put into isolation, they are progressing extremely well. The first case is now very well. All the symptoms are gone. He's more than happy to go home. The doctors have, however, been unable to let him go home because they are waiting, according to the protocols given to us by the World Health Organization, for him to actually test negative for the virus to be out of the system. Then that is when they will let him out. But he is fit, he is good, he is healthy now. We are just waiting for his wife to actually also get to that stage, but she is getting there as well. She's getting better. The first patient has no symptoms at all anymore. We're just waiting for that test, and then we'll be able to send him home.
Thank you very much for that update and for this conversation. KwaZulu-Natal Health MEC Nomagugu Simelane-Zulu.